For a contrast, let's look at a small group of 3 physicians who practiced in a small rural community for over 35 years together. In that 35-year period, they were never sued for malpractice and they never fought about money or patients. We will see why personal leadership is so critical to avoiding what seems to be so problematic in today's medical culture.
These guys seriously are closer than my own family. They're closer than brothers to me. But of course, we went through a lot together.
Many common memories.
We grew up in the practice of medicine together and we worked out our problems together, and they are much closer to me than my own family.
We were together for a long time because I think we liked each other, basically, and respected each other. I think we were supplemental to each other insofar as our medical knowledge.
Well, I consider the most important thing in patient satisfaction is complete communication. Of course, that hinges on mutual respect and experience and previous associations and track record. I think track record gets in the act.
Unless you are totally isolated and by yourself, yes, you have to have teamwork if you're going to function efficiently and well. But the teamwork with the nursing staff, the teamwork with your fellow physicians, teamwork with the various therapy groups is all real important, and I think we always had a good rapport with those people because we respected them and I think they respected us.
Because of our limited lab availability, we became good listeners. And if you sit and intelligently listen to a patient, do your basic physical examination, ask the right questions. Forget about the lab work. That patient's going to tell you his diagnosis before he leaves the office. But you've got to listen. And too many physicians are not listening to what the patient has to say.
Our people respected us and felt like we were doing the best we could. We deserved an occasional suit that we didn't get because of that community respect. There were times when we made mistakes that would probably have deserved compensation, but the mutual respect of that I've alluded to earlier, I think was an awfully big factor in the whole situation. And they liked us as individuals. They thought we were doing the best we could, and they knew that nobody bats 1,000. And it never bothered me to admit to the next of kin or whoever was involved that if I had it to do over again, I might do it differently, you know. But it never bothered me to and I think that's reassuring to the public that you're willing to admit your capacity to make a mistake.
I think the most important thing I could say would be to be honest with yourself. Intellectually honest honesty is probably the most important thing I could think of.
Well, I would consider the most important advice to pass on to a young physician, whether I summed it up as I thought about this question in 3 words. And first I would say integrity, and second would be compassion, and third would be honest with yourself.
And this boy was terminal. He was in the hospital. He was dying. He was semi-comatose. And I was out the hospital because I had the duty. I was out there working, doing this and doing that and seeing some outpatients. And all through the course of this last boy's evening, I was in and out of the room with this family, giving what comfort I had. I knew there wasn't anything else I could do as a physician. It had all been done. I was in the room for the last 30 minutes of the boy's life, talking to the family, holding his hand. Terrible tragedy for a family. And throughout the course of several years after that, every time I would see the mother of this boy, she didn't talked to me about being grateful for the great surgery that I'd done on this family through the years. She was eternally grateful for my presence in that boy's room, giving support to the family and to him in his last few hours of life. And I think this personal touch means more to people than the great scientific achievements that we've accomplished in medicine. There's no question but what they're great. But when you get right down to the nitty-gritty, it's the personal touch that matters.